All right, hello everyone. I wanted to come back today with a cool case that I saw from teledermatology, which I do on nails. And I wanted to present this case for a few reasons. One, I think it's really an interesting case, which I'll reveal the diagnosis at a future point in time. But two, and probably more importantly, I want to kind of highlight the purview that dermatologists have. I might have mentioned this in a previous video, but you know, the field in general is called dermatology, the study of skin, but we really do more than that. We manage, diagnose, and study conditions of the skin, hair, nails, and mucosa, and we're really experts in all those fields. So I kind of wanted to highlight that by this nail case that was sent in, being able to appropriately render the diagnosis, generate a treatment plan, and really help the patient. So this is the same nail, just two views. I want to draw your attention first to the right so that you're looking here at the dorsal aspect of the nail plate. So feel free if you'd like to pause the video at this point and look at this image and try to generate a differential diagnosis because I'm going to talk through some of the findings again without revealing the diagnosis. So what you're seeing here is multiple things. The first thing that should draw your attention here is the lunula. So the lunula is the portion of the nail matrix that's visible through the nail plate, and it's the distal end, so it's where the nail matrix ends. Typically the lunula, if you draw it out, should come right about up to here. So this is an enlarged lunula, which means that you have lunular hypertrophy, which means you have nail matrix activation. Now, that's not an entirely specific sign, but in general, it just tells you that the nail matrix, which lives predominantly under the proximal nail fold, is too revved up. It's too revved up for some certain reason. One possible etiology for it being revved up is because there could be a benign growth or a malignant growth that's sitting on or around it, causing it to get revved up in a reactive manner. Sometimes it can get revved up because the patient is picking at their proximal nail fold. That can do it. Maybe there's a chronic infection like a paronychia, which could cause lunular hypertrophy. So not a completely specific finding, but can give you a clue to what's going on. The next thing, if you look at the nail plate, you'll see that the parts here are normal, but there's multiple abnormalities within the kind of inner or medial aspect of the nail plate. Immediately, your eye is drawn here to a vertically oriented, so a longitudinal uh, uh, brown streak. And so you have this brown streak here. And typically what happens when you have growth or any type of abnormality in the nail matrix, it grows all proximally to distally. So when you have a streak like this, which is in one plane, proximally to distally, it tells you that there's something happening up here or over here in the proximal or distal nail matrix, which is causing this finding that you're seeing. You're also seeing this yellow, if not possibly green, discoloration to the nail plate and some red spots here. So we have lunular hypertrophy, this vertical line here, vertically oriented line, yellow-green discoloration, red discoloration, and then you have some surrounding erythema and scale on the nail. Now, what I thought was really cool, kind of really neat, is that they actually, in this telederm, took a picture on FOSS or kind of looking right at the nail from underneath the nail plate to show you some pathology that was happening underneath. And that's actually super helpful for the diagnosis of this entity. And what you're seeing here is that the nail plate is lifted. So normally the hyponychium should kind of serve as an area where the nail plate is glued down to the actual finger. And here it's lifted up. And you see that there's this subungual hyperkeratosis, subungual debris, subungual growth that's causing that lifting. And so these are the clinical clues that you see. Again, kind of summarizing here, lunular hypertrophy, vertical streaking, discoloration to the nail plate, onycholysis, which is lifting of the nail plate with subungual hyperkeratosis. And so you put it in this bucket, you're recognizing these abnormalities, and from there you can generate a differential diagnosis. It just comes with time and knowing what entities could generate this problem. But again, without knowing any single entity, you can kind of tell where this problem is going to be. Lunular hypertrophy and this nail streaking needs, the matrix has to have been insulted. The nail plate lifting with an underlying growth means that the nail bed must have been insulted. So we're looking at some type of growth or entity that can affect both the nail matrix and the nail bed. So think about it. Feel free to comment your differential diagnoses, and we will reveal the diagnosis in the future. Thank you.